Part of the muscle is called the piriformis. The origin of the piriformis is the 2-3-4 costotransverse bars of anterior sacrum. Few fibers from superior border of greater sciatic notch. The insertion of the piriformis is the anterior part of medial aspect of greater truncanter of femur. So this portion is called the superior gemellus. It is below the piriformis. The origin of the superior gemellus is the spine of ischium. This part is the obturator internus. It is below the superior gemellus. The origin of the obturator internus is the inner surface of obturator membrane and rim of pubis and ischium bordering membrane. This portion is called the inferior gemellus. It is below the obturator internus and the origin is the upper border of ischial tuberosity. The insertion of the superior gemellus, the inferior gemellus, and the obturator internus is the middle part of the medial aspect of greater truncanter of femur. This large chunk of muscle is called the quadratus femoris, and the origin is the lateral border of ischial tuberosity. The insertion is the quadritubercle of femur and a vertical line below this to the level of lesser truncanter. The origin of the obturator externus is the outer obturator membrane and the rim of pubis and ischium bordering it. The insertion is the truncanteric fossa on medial aspect and greater truncanter. So going to the palpations, so this part is the pectineus, and this is the adductor brevis, and the abductor longus, and the gracilis, this part, and the adductor magnus. This portion of your muscle is called the tibialis anterior, and let's pretend that this portion is the tibial bone. So for the origin is the lateral condyle and the 2/3 of the tibial shaft and the interosseous membrane. The insertion of the tibialis anterior is by the tendon into the inferior surface of medial cuneiform and first metatarsals. So for the action of the tibialis anterior, it is the prime mover of the dorsiflexion, inverts foot, and it also assists in supporting medial longitudinal arc. This portion of the muscle is called the extensor digitorum longus, and the origins are the lateral condyle of tibia and the proximal 3/4 of fibula and the interosseous membrane. The insertion of the extensor digitorum longus are the middle and distal phalanges of toes 2 to 5 via extensor expansion. The action of the extensor digitorum longus, it is the prime mover of the toe extension mainly at the metatarsal joints, and it dorsiflexes foot with tibialis anterior and extensor hallucis longus. This portion of your muscle is called the extensor hallucis longus, and it is in between the tibia and the fibula. The origins of the extensor hallucis longus are the anteromedial fibula shaft and the interosseous membrane. Insertion of the extensor hallucis longus is the distal phalanx of big toe. Two. The red marking is called the peroneus tertius. The origin of the peroneus tertius is the third quarter of the anterior shaft of fibula. The insertion of the peroneus tertius is the shaft and base of fifth metatarsal. The action of the peroneus tertius, it extends and inverts foot. The blue marking is the peroneus longus. The origin of the peroneus longus are the upper 2/3 of lateral shaft of fibula, head of fibula, and lastly, the posterior tibiofibular joint. The insertions of the peroneus longus are the plantar aspect of base of first metatarsal, medial cuneiform, and passing deep to long plantar ligament. The action of the peroneus longus, it plantar flexes and inverts foot, and it supports lateral, longitudinal, and transverse
arches.
Green marking is the peroneus brevis. The peroneus brevis is the lower two-thirds lateral shaft of fibula. The insertion of the peroneus brevis is the tuberosity of base of fifth metatarsal.
Action of the peroneus brevis, usually at the plantar, it flexes and inverts foot and supports lateral longitudinal arc.
So this portion of the muscle is called the rectus femoris, and the origins are the anterior inferior of the iliac spine and the superior margin of the acetabulum.
Action for the rectus femoris, it extends the knee and flexes thigh at hip.
This portion of the muscle is called the vastus lateralis. The origins are the greater trochanter, intertrochanteric line, and linea aspera.
So the action for the vastus lateralis, it extends and stabilizes the knee.
This portion of the muscle is called the vastus medialis, and the origins are the linea aspera and intertrochanteric line.
The action for the vastus medialis, it extends the knee and stabilizes the patella, specifically the inferior fibers.
So this portion of my muscle is called the vastus intermedius, and the origins are the anterior and lateral surfaces of femur.
The action for the vastus intermedius, it extends the knee.
So for the insertion of rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius are the patella and tibia tuberosity via patella ligament. So this portion of my muscle is called the sartorius, and the origin is the anterior superior of the iliac spine, and the insertion is the medial aspect of the proximal tibia.
So the action for the sartorius, it flexes abducts and laterally rotates the thigh, and it flexes the knee.
This marking is the semimembranous, and its origin is the ischial tuberosity, and its insertion is the medial condyle of the tibia.
The action for the semimembranous, it extends thigh and flexes knee, medially rotates leg.
This marking is called the semitendinosus, and its origin is the ischial tuberosity, and its insertion is the medial aspect of the upper tibial shaft.
The action for the semitendinosus, it extends the thigh and flexes knee, and it also medially rotates leg with semimembranous.
This muscle is called the bicep femoris, and it has two types of muscles, which are the short head and the long head. The red marking is the short head, and the long head is the black marking. The origin of the bicep femoris for the short head is the ischial tuberosity, and the long head are the distal femur and the linea aspera. Insertion is the common tendon into the head of fibula and into the lateral condyle of tibia.
So the action for the biceps femoris, it extends the thigh and flexes the knee, and it laterally rotates leg when knee is flexed.
Flexor digitorum longus, and its origin is the posterior tibia, which is this part. For the insertion, the tendon runs into the medial malleolus and into the distal phalanx of toes 2 to 5.
So the action of the flexor hallucis longus, the plantar flexes and inverts foot, and flexes big toe and push off muscles when walking.
So this portion of the muscle is called the tibial posterior, and its origins are the upper part of the lateral shaft of tibia and the interosseous membrane. So the insertions are the inferomedial of the medial cuneiform and the base of first metatarsal.
The action for the tibialis posterior, it extends and inverts foot at ankle, and it holds up medial longitudinal arc
Let's
of foot.
pretend that this yellow marking is the tibial posterior, and the blue marking is the flexor digitorum longus, and lastly, the black marking is the flexor hallucis longus. The origin of the flexor hallucis longus are the midshaft of fibula and the interosseous membrane. Insertion of the flexor hallucis longus is that the tendon runs underfoot into the distal phalanx of big toe.
The action of the flexor hallucis longus, the plantar flexes and inverts foot and flexes big toe and push off muscles when walking.
So the blue marking is the gastrocnemius and the red marking is the soleus muscles. So the origin for the soleus are the supertibia, interosseous membrane, and the fibula. The origin of the gastrocnemius are by the two heads from medial and lateral condyles of femur. The insertion of the gastrocnemius and soleus is the posterior calcaneus via calcaneus tendon, also known as the Achilles.
The action of the gastrocnemius, the plantar flexes foot and flexes knee when foot is dorsiflexed. So the action for the soleus, the plantar flexes foot when knee is extended, important locomotor and postural flex.
Plantar dorsiflexion.
The plantar flexion is the motion of pointing the foot downwards. The muscles involved in the plantar flexions are gastrocnemius, soleus, plantaris, flexor hallucis longus, flexor digitorum longus, tibialis posterior, peroneus longus, peroneus brevis. Dorsiflexion is the flexion of the foot in an upward direction. The muscles involved in the dorsiflexions are tibialis anterior, extensor hallucis longus, extensor digitorum longus, and lastly, peroneus tertius.
Eversion.
Consists of turning the ankle so that the plantar surface of the foot faces medially toward the opposite foot. Eversion. Eversion is turning the ankle so that the plantar surface faces laterally.
Abduction. Adduction.
Upper limbs away from the body, such as in the outward portion of doing jumping jacks, is abduction, and bringing the upper limbs back toward the body is adduction. Pronation is the rotation of the forearm so that the palm faces posteriorly in relation to the anatomical position. Supination. Supination is rotation of the forearm so that the palm faces anteriorly in relation to the anatomical position. The muscles active during pronations are the anterior tibialis, extensor digitorum longus, and extensor hallucis longus. So the marking of the medial longitudinal arc is this. And marking to the transverse arc is from the calcaneus to the middle phalanx. And lastly, the lateral longitudinal arc. The muscles involved in the lateral longitudinal arc are peroneus longus, peroneus brevis, flexor digitorum longus, and lastly short muscles of the little toe. The muscles involved in the medial longitudinal arc are tibialis posterior, tibialis anterior, flexor hallucis longus, flexor digitorum longus, and lastly short muscles of the big toe. The muscles involved in the transverse arc are peroneus longus, peroneus brevis, transverse head of adductor hallucis, and lastly, slips of tibialis posterior.